My name's Steve, I'm a Chief Inspector within the Police Service and I have responsibility for mental health for my force. The police's role in relation to mental health really falls under the powers under the Mental Health Act. We sometimes support approved mental health professionals in going out and doing assessments at people's home addresses. We also involve ourselves occasionally in supporting the ambulance service, conveying people who've been detained under the Mental Health Act to places of safety. And then there's police powers under the Mental Health Act that if we come across somebody who's in mental ill health crisis, we have powers to detain them under the Mental Health Act and take them to a place of safety. Usually that's a healthcare based place of safety such as a hospital or a mental health unit. There are occasions when people with mental health issues commit offences, and obviously one of the roles of the police is to determine whether the offence has been committed because of the mental health issue or the offence has been committed by someone with mental ill health problems. Obviously we're always seeking to support people, so if it's a requirement to go down the mental health route, we will, but often people with mental ill health problems who do commit offences will come into custody, they will be arrested for the offence, but what we do is make sure that people who are mentally vulnerable, if they have committed an offence, like any other member of the public, is safeguarded whilst they're in police custody. And something called the Police and Criminal Evidence Act means that certain safeguards are put in place if people are mentally ill or mentally vulnerable, and one of those safeguards is that we would always get them an appropriate adult to represent their interest while they are in custody, and the normal investigative process continues into investigating the offence for which they've been arrested. The police service generally is understanding that mental health is an issue for us, and therefore we're working far more closely than we've ever done with mental health services. But the three main areas where I think the police supports mental health services are firstly, where mental health professionals have to go out into the community and assess people, some of those assessments can be problematic, and therefore the police can on occasion be required to support the mental health professionals in going into people's home addresses to assess that they are whether they're mentally ill or not and whether they need treatment. The other area is, of course, that where people are in mental ill health crisis and the police are called to them, the police have powers to detain them and take them to a place of safety. And what we'll always try and seek to do is take them to a health-based place of safety rather than the police station. The other thing that we do is, if people do come into custody and have got mental ill health problems, most police services now are working closely with mental health professionals to bring them into the custody environment so that people can be assessed in custody as well. So really what we're seeking to do as the police service is make sure that the most appropriate treatment is given to people who have got mental ill health and support mental health services in the work that they do, both out in the community and within the sort of criminal justice system.